PS Mudhoni, karibu sana. Here's a PS for public health. How are you doing?
I'm very well. Yeah.
First of all, our condolences. You lost your father the other day. How are you doing?
I'm very well.
Happy
I'm
Mashujaa
doing
Day.
good. Happy Mashujaa Day.
What are your expectations today?
First and foremost, I'm very happy because God has been able to bring us up to this far. And I want to encourage everybody today that you are a Shujaa in your own space, in your small space, because each and every one of us, we are doing the very best for this country. Influence your small circle, and your small circle will influence everybody else. And that is how we are going to grow this
As we
country.
celebrate Mashujaa Day, PS, the question of the social health insurance, how are you addressing the concerns Kenyans have regarding SHA?
I think on SHA we are on course. Really, we are on course. And every other thing, whether it is a building or a small thing or a new project that is starting, you need to understand that there could be some few challenges here and there. But on SHA, we are on course. And I want to encourage each and every Kenyan to ensure that you register for Social Health Authority, because this is the only way that we can be able to protect and give Kenyans the available, accessible, affordable, acceptable quality healthcare. And number two, NHIF used to cover only 20% of Kenyans. Right now, we want to enroll everybody, even the person who cannot pay the 300 shillings. The government has come out to say, we are going to pay for you. You only need to register. For those of us who are salaried, then our salary will be 2.75 of our gross salary, to ensure that we also spread out to other people who we always go back to our pockets to pay for their fees at the hospital. Therefore, social health insurance and the social health insurance fund is a good thing. Under SHA, we have 3 funds. And one of the funds is the one that is going to take care of the mashinani hospitals, dispensaries, health centers, the health facilities which we call level 2 and level 3. And remember, any time you go to any health facility, whether it is faith-based, public, or even private, you will be charged, the first charge will be the Social Health Authority. So our public primary healthcare fund is going to take care of those lower level facilities. Then the second one is the Social Health Authority, what basically we used to call NHIF. But remember, it has been enhanced. Things to do with maybe screening, diagnostics. Some of them never used to be there. You can now go to hospital and be and probably be checked for cancer. Like this month is Breast Cancer Awareness Month. It is important that ladies come out in large numbers and they can use their Social Health Authority their ID card to ensure that they have been screened. And then the final one is the Emergency, Critical and Chronic Illness Fund, which sometimes when you are in ICU, you cannot even go to your ATM to get the money. So how do you wake up and start going to look for money so that you're treated and you're already in a critical care? Emergency, you have seen accidents. Every now and then you are in an accident, you've been hit by a car, a border or something like that. When you go to hospital, many a times these facilities will ask you for 10,000, 20,000, 50,000, so that uitiwe daktari mkuu. We do not want to go to that point. We want anybody can access any facility in this country and be treated for better. So I want to encourage Kenyans, please register for Social Health Authority and ensure that you get covered, because that is the only way to go. Our rolling out of the community health promoters again was a game changer.
CHPs.
The CHPs. The 107,831 community health promoters. These individuals are people who live with us. They have commodities. They'll take your blood pressure, your blood sugar. Already 8.7 million Kenyans have been registered in our electronic community health information system. In Kwale alone, we also have community health promoters. And when you look at the kind of the walking patients we have in our communities, the numbers are huge. 6.5 people you find screened for diabetes, and probably more than 100,000 have already been referred for further assessment in the health facilities. Again, a big number of about 4.8 million Kenyans screened for hypertension, and more than 250,000 people have been referred to the health facility for further assessment. Remember, the CHP will refer you, and she or he will come back to your household to check whether you really went to hospital and whether you have started medication. So there are many things that we are doing in the health sector. We might seem like we are slow, but really we are on the right track. And I want to assure Kenyans, there has never been any other time that this country can get better in terms of healthcare. And in the ministry, I've told you, we are looking forward to providing accessible, available, acceptable, and affordable quality healthcare.
Happy Mashujaa Day, PS.